And we'll kind of do it popcorn style. I trust you guys. So we'll go ahead and start with Eric, if you don't mind starting us off.
All right. Excuse me. My name is Eric Fries. I'm the athletic director and athletic trainer at Coconino High School. This is my 31st year here. I'm an alumni from NAU twice. And easily my most important thing that I can instill upon the students is remember who you are working for, meaning the players or your patients that you're dealing with 100% of the time.
I'll go. Hello, everyone. My name is Dr. Corey Oshikoya. I'm a athletic trainer, and I'm also an assistant clinical professor here in NAU's athletic training program. And one piece of advice I think I'd like to leave you with is never stop learning. I'm going to pass it off to Alexa.
All right. Hi, everybody. My name is Alexa Perdomo. I'm a first-year grad student here at NAU. I would say the biggest piece of advice I've held on to is that everybody is so unique, which means every situation and every injury, no matter how big or small it is unique to that individual, and you'll never see something really repeat all the time. So you got to treat everybody as an individual, and you got to treat their injuries as unique as possible. Let's go, Lauren.
Hi, my name is Lauren. I'm a second-year master's student. I'm currently placed with NAU football and the recipient of the 24-25 Michael Nesbitt Scholarship. The biggest piece of advice I have is to treat everything as a learning opportunity and always use that to grow and better yourself. I'll pass it off to Liz.
Hi, I'm Liz. I'm also a second year grad student with the NAU Athletic Training Master's Program. I think the biggest piece of advice that I would give is just don't be afraid of failure. Failure can be one of the biggest learning tools that you have. And if you're too afraid to fail, then you're not really going to succeed to your full extent. So accepting that failure is a possibility in a lot of cases, and inevitability, preparing yourself to make sure those situations are handled safely, of course, but you have to be willing to fail in order to succeed. Sorry, I forgot I was supposed to call out somebody. Let's go, Oscar.
What's going on, guys? My name is Oscar Arroyos. I'm also a first-year MSAT student here at NAU. Piece of advice I would say is kind of like keep learning, like Dr. O said, but don't be afraid to ask questions. Like, don't just be sitting there wanting to ask these questions and wanting to learn, but being scared to do it. Just go out there and keep learning as well. Let's go, Katie.
Hi, I'm Katie. I'm a first-year master's student at Flagstaff. My piece of advice is it's okay not to always have the right answer. Like, you gotta fail, like Liz says, and you always gotta learn from those opportunities. Let's go, Fabian.
All right, hi everybody. I'm Fabian. I'm a second-year student for the MSAT program. Piece of advice, kind of one that I carried along with me that one of our professors told me up in Flagstaff was one test doesn't define you. You're gonna have opportunities to, as everybody has been saying, you learn more when you fail than when you succeed. So, yeah. Then I don't know if there's anybody left. I think that's everybody.
Yeah, I think that's everybody. Thank you all so much. We'll jump right into our first question, and it's for Dr. O, and that is, what is an athletic trainer?
So an athletic trainer is a certified individual and licensed healthcare professional who specializes in the prevention, the diagnosis, recognition, treatment, and rehabilitation of injuries and illnesses, primarily of people who are physically active. And so we typically find athletic trainers in settings where the people are active, and that could be in sports medicine clinics. That could be in a variety of places such as the high school, college settings, professional leagues. Certainly you can find them in a variety of other places where people do a lot of physical activity. So now people are in what we consider the industrial setting, a setting where it's at Amazon or airline companies, So a whole host of places where athletic trainers are interacting with people who are performing physically active activities, and we specialize in treating their injuries, also associated with the illnesses that they may have.
Fantastic, thank you. Moving right along, our next question is for Eric. And what does a day-to-day look like as an athletic trainer?
Well, that varies drastically based upon setting, obviously, but in my situation, high school, there's a tremendous amount of athletic trainers that work in high school that teach as well, but fortunately, it is becoming much more prominent that individuals are being hired to be an athletic trainer to do just that job. So typically late afternoon until done. I always like to use the analogy. In fact, I mentioned it to Corey yesterday. When people say, what's your schedule? And you kind of look at them crooked because there is no such thing as a schedule. Because the example I always give is, when's the baseball game going to be over? Well, it could go 7 innings. It could go 87 innings. I haven't the slightest idea. So anywhere in between. So lots and lots of time. Obviously, the vast majority of it, early afternoon till potentially late evening. In the high school situation, obviously working with that particular clientele. If you're teaching, you've got teaching responsibilities typically in the morning or at least late morning, early afternoon. That's a possibility as well. And, I absorbed the athletic director position 16 years ago. So I was that and the AT for 7 years, which is insanity. I do not recommend doing that for anybody listening. Advocate for being the athletic trainer, specializing in that healthcare for those athletes in that high school on a day-to-day basis.
Awesome, thank you. So the next question is going to be for our students. So feel free to popcorn to one another to get all of your answers for this one. But it is, what does wanting to become an athletic trainer mean to you, and what got you started in the field? Maybe we can start with Oscar.
Yeah, so what does it mean to be an athletic trainer to me? I mean, to me, it's, I've always liked sports, and medicine's always been a topic of like my mind. So why not combine those two things together and stick with those sports? And, it's like a progress depending on what setting you are. Like if you're at a high school setting, you're obviously setting them up for success to go to a collegiate level. If you're at a collegiate level, you're setting them up for success to possibly be at a professional level, or just a different type of level after college. So to me, being an athletic trainer is just being someone that's there for these athletes when they're at their lowest points and helping them build those steps back up to being as proficient as they can in the sports that they can do. The way I found athletic training was in high school. I played sports there, and I just got super close to my athletic trainer. And little by little, she was teaching me things, and I was absorbing it. And I just truly fell in love with it after that. And I'll pass it off to Fabian.
I mean, Oscar kind of said it all. Kind of the similar things, like, for me, it's like my main goal is kind of to be an athletic trainer at a high school setting, because I want to, like how Oscar was saying, have them reach their like kind of fullest potential to reach on to the collegiate setting. And for me, like my experience with an athletic trainer wasn't the same as Oscar's. Like for me, like we didn't have an athletic trainer in my high school, and the moment that we did, that's when I kind of started finding out like, okay, there's a supply, like there's a demand for athletic trainers. I want to be one of those people that can help an athlete get better with like rehab, or like just like also just being there because just with injury, a lot of people start getting into like that phase of like, okay, like I don't want to go back to sport because of this. Like no, like we as athletic trainers are like, what we can do is help them get better, and like not just like physically but also like mentally prepare themselves as well. Popcorn to Katie.
So similar idea, I have a parent both in the sports world and then a parent in the medical field. So I loved both of those settings. So it's a happy medium for me. I found it through my athletic trainer in high school. I subluxed my thumb during volleyball, and it happened 4 times over the past year. So she was like, hey, we need to work on this to fix it. To be an athletic trainer, I think you see the highest of the highs and the lowest of the lows, and you're just there supporting the athlete as they go through those settings. I'll pass to Lauren.
I feel like I had kind of a different introduction to athletic training. So I graduated high school in 2020 when COVID was pretty high and didn't really know what I wanted to do. So I came to NAU and I knew that there was an athletic training undergraduate internship. And I was like, you know what? I'll give it a try, see if I like it. And it ended up making my entire undergrad experience where I just learned so much and like was really introduced to like the world of athletic training and how it works at the Division 1. So that's where I got like inspired to be an athletic trainer. And then throughout that whole experience, I just got to see how the certified athletic trainers cared for their athletes. And I realized that's something that I want to do and really be a great healthcare professional. So that's why I got into athletic training. I'll pop it off to Liz again.
So, for me, being an athletic trainer it's a role that really requires a lot of dedication and time. We're one of the few healthcare professions that typically see our patients daily, whether they're healthy or sick. You know, we see them all the time. We're at the school, at the site where they're at least in the traditional setting, and in most settings, unless you're in like a clinician, a physician's practice. Um, to me, I went into wanting to be an athletic trainer, wanting to work with high school students or at least like junior college, like the younger side of it, because I wanted to be an advocate for those students. Especially in high school, the athletic trainer is an advocate for the student's health and is somebody that's there to hold their hand and explain to them kind of what's going on. You might be one of their earliest relationships with a healthcare provider that they really trust. So you're able to build kind of their idea of what a healthcare provider can be for them, and are there in some of their scariest moments, especially when they're younger and they don't know what's going on and they are terrified that their life is over, their season's over, all this stuff is going on, and you need to be there for them. That is pretty much the story of how I found athletic training and decided to pursue this role. I had my own injury my junior year of high school. It's called the unhappy triad. Basically busted out my entire knee and was terrified, of course, of like, I'm done with volleyball, I'm done with softball. I wasn't able to participate in sports anymore. But my high school athletic trainer was really great at taking me aside and just showing me that, hey, it's going to be okay. This is our plan moving forward. Knowing that there was a plan was a huge relief to me as a high school athlete. So I wanted to be that for somebody else. I wanted to provide that opportunity of relief for that student whenever they're in one of their scariest moments. As well as I wanted to be a mentor to somebody later on. I wanted to show the world of athletic training to a future student that might really love this industry and really love what this can be for them. And with that, I think Alexa, or do you still need to go?
Yeah, thank you, Liz. So I'd say like mine was definitely different. I took a course, an ROTC course, my sophomore year of high school, and it was a very broad like sports medicine class. And at first I was like, oh, well, I need the elective. This sounds cool. Like, let's take it. And it ended up being like the best experience because the teacher I had was incredibly honest about the ups and downs of this field. And that kind of made me fall in love with it. I was like, you hear when you talk to people about different careers, always like, oh, it's great because of A, B, and C to convince you to do it. But nobody's honest about like, well, here are the lows, like here are the tough days and the things you'll experience. And so I think for me, being able to hear that from her, I was like, I can handle that. I was like, I want those lows, I want those challenges. Like, let's go, let's do it. And so I've kind of been on that track ever since like my sophomore year in high school. And like I've been interning ever since I was like a junior or senior in high school and been through a lot of different sites. So over that time, I learned like it means being as kind and as patient with yourself as possible. You're gonna have a lot of long days, a lot of highs and lows, but if you're patient with yourself, that makes it easier because you're not gonna know everything, and you're gonna get those, odd cases where you're like, I don't know, or you know what, I don't remember, and like I'm human, and I'm gonna be honest and be like, I don't remember, like let's figure it out together, like you and the athlete. So I think it's truly about being kind with yourself and remembering that you're human, and being patient because it's a long process and it's a lot to learn and it's a lot to remember. And I think like if you have those two things in mind, like it's very doable and you can have a great career if you're just kind to yourself.
Those are all great. Thank you so much, everybody, for sharing your stories. I think that just emphasizes how passionate everybody is about this career and this career path. And I think that just further solidifies like you are in the right spot, like you are where you're meant to be. So I'm just very happy for you all and excited for your future. So moving on to the next question is for Dr. O, and that is, what should undergrad grades look like to get a better chance of getting into AT school?
Excellent. So I think undergrad grade should hopefully be above a 3.0. I think that's the minimum requirement that we have getting into the program. But certainly the higher the better. We certainly look at grades as an opportunity to look at your past experiences and look at all of the previous and prerequisite courses that we have and we need you to take before you can become a graduate student. So there's a list of prerequisite courses on the website that you should be taking, but certainly grades should be north of or beyond the 3.0. We have taken students who have been below that with other circumstances, but ideally, the higher the better. So it's fairly competitive. We do have 2 cohorts. So we have 2 locations, both a Phoenix location and a Flagstaff location. Each location is probably a little bit different based on the students that go there, but certainly above a 3.0 or 3.5 can certainly benefit you in getting into the program.
Fantastic. And then just to add on another question, Corey, the curriculum, is that the same? Is the environment just going to be the main difference? And then the cohorts as well for Flagstaff versus Phoenix?
Sure. So definitely the curriculum is 100% the same. There's faculty on both campuses, both the Phoenix and the Flagstaff campus. All classes are taught in the same semester, and all classes are generally taught on the same day at the same time. And both of those professors do spend a significant amount of time collaborating with each other, understanding these are the things that I'm teaching, and then the other professor teaches the same thing. And so you collaborate backwards and forth so we understand and know that both campuses, everyone is receiving the same content. It may just be delivered a little bit different because, I may be a little bit stuffier and somebody may be a little bit more jokier but whatever that looks like. But the content is always the same on both campuses. I think Flagstaff is typically more of a college feel and it's more of a college community to it. And then those who are at the Phoenix, it's more of a downtown building. And so it may be a little bit more commuter style if that's what you're looking for.
Awesome. Thank you so much. This next question is for Eric, and this was a student requested question, and that is, what is your favorite and maybe least favorite thing, if you have any, about working in the field?
Okay. Easily the most favorite thing is getting to take care of high school athletes, their quirkiness from freshman to senior, the mass amount of difference that happens between that 4-year time frame is quite remarkable, especially in the males, because they come in with size 14 feet and can't walk, and by the time they're a senior, they're a heck of an athlete. Nothing against the females, they're just more mature when they get to us. The freshman boys aren't there yet. So I would say that's easily the best thing is understanding those personalities and getting to interact with that student group on a regular basis. As an athletic trainer, I would say the least favorite thing, I got to take my AD hat off. As an AT, the least favorite thing I would say would be probably watching freshman girls basketball or freshman softball. We don't even have freshman softball anymore, thank the Lord. But those are trying times because typically, absolutely unequivocally, nothing ever happens. And it's very bad sports most of the time just because of the age level. I spend a tremendous amount of time not watching that. I'm present, but I'm just kind of there doing my other duties, so I don't have to really watch that particular event. But I would say, and that's not necessarily a worse thing. That's just maybe one of the most challenging things about my level.
That's great. Thank you. As a softball player myself and playing in freshman year, I think my mom would agree with you that was probably her least favorite thing to watch us growing up.
We're in the 3rd inning. It's 26-25, and there's been 1 earned run.
Right?
Yeah.
Sounds all right. Yeah. Awesome. Thank you. So students will kind of do the same format. After this question, you can popcorn off to one another, but that is, what is your favorite part about athletic training school, or maybe has there been a pivotal moment in school that kind of was eye-opening to you, or any story that kind of caught your attention as you're moving through this program? And maybe we can start with Lauren.
I think what sticks out the most to me is the community that you build with your cohort. Um, from my first year last year, I still talk to all of my classmates, all of my preceptor from last year too, actually. So it's just the community that you build is really great. Like you have students who are going through the same exact thing and they can help you with schoolwork or studying, or just like if you need someone to talk to about something as well. Like you just build a really great community with all your students around you and like your preceptors and your professors as well. So it's just a great environment to be in. Let's go Alexa.
Right. Yeah, I had actually written down a similar thing, like the fact that from beginning to end, you either sink or swim together with your cohort. You stick everything out together, like any troubles, like there's always someone to talk to and someone else who just understands what you're going through and like can work with it. Like Oscar and I are both assigned to cross country track at NEU, and we spend like 24/7 together. I see this guy all the time, but like that's great because anytime I have like didn't understand something in class, we go to clinic together and we talk about it and we figure it out together. But also having such like a small staff of professors has been really great because they're very vocal about they are there for us, and they want to see us grow not only as future clinicians but as individuals as well. Let's go Liz.
Yeah, I agree with both of those. The relationships that you make in that first year are amazing as like a community base, and also you guys are all just kind of going through the same stuff together at the same time. It's a nice thing about how the classes are built up. It's different from like an undergrad setting where you just kind of pick what classes you need to fill in like your needs. Like it's a very structured program, so you know exactly what courses you're taking in the spring and the fall and all of the above. So since you're going through it with the same, I was in the Phoenix cohort, so the same 20 people for the entire time, you definitely build a really close relationship and have that to fall back with. I did have like a big defining moment for me that really made me love this experience in this program was actually a little bit earlier this semester. And it was the moment of like, I can do this. I feel like all of last year I was terrified, just trying to learn all these different like diagnostic techniques and trying to make sure I could file away all the different treatment modalities that we needed and all of the different information that we have to take in. And I was just like, how am I ever going to get to the point that I can do this and be a competent athletic trainer for students? And early this year, I had an experience where my current preceptor, that's the person that kind of like oversees us. And in your second year, you just have like the one preceptor to one student, had trusted me to like, hey, go take care of the athlete. You're in charge of this game. She was on the field and of course overseeing everything I did, but she said, you're in charge of this flag football game. So I went out, took care of an athlete and felt great about it and didn't have any moments of like, I didn't know what to do or I didn't know how to take care of it. And reflecting on that later, I was like, that's the first moment that I didn't like freeze and like have a whole bunch of panic on, okay, I have to think for a second, what am I supposed to do? And it was just a lot more natural. So that was like a big moment for me that made me just take a deep breath of, I will get to that point. Now, not everything I'll be perfect at still. I'm gonna have a lot of like moments where I'm gonna freeze up, but it was great having that moment of I knew what to do. I knew how to check this injury. I knew how to make sure the athlete was okay and go from there. So that was a big moment for me that made me really love it. Let's go Fabian.
Yeah, you got it. I think for me, like at least my favorite part has been like just like the structure of the clinical rotations of like how we're able to kind of like branch off into our for like our second year, how we're able to branch off. And right now, like I'm currently at Arizona Western over here in Yuma, Arizona. And like it's an experience like I've always been at a high school and wanted to give it a change. So I'm like here at the community college setting, and so I'm like completely enjoying it. It's just a different feel from a high school to the community college. And then just especially like being at this high level, I had a similar like experience, just like Liz said, like pretty much like my preceptor was right there next to me. And my preceptor was like, hey, like you're gonna be in charge, like I'll be behind you the whole time, but I want you to like pretty much take care of this, like it's just you. And I'm like, okay. similar experience, like, got to take care of an athlete like on the field, got to pretty much like determine like a rather return to play. And I just think that just pretty much like the having that trust from the preceptor was honestly like the best feeling, because like I had my doubts at times, but now I'm just kind of like, okay, I know what I'm doing, like I know like what I gotta do and how to do it. So just pretty much like a breath of fresh air after that. Let's see who's Katie.
I would say like the format of the program altogether is my favorite. I like that we have small classes. Like our Flagstaff cohort only has 12 people in it this year, so like we are like one big family. When someone walks into like our space, it is kind of like, who are you? Like we're not used to having you there. Our teachers are definitely very dedicated to us. I think they definitely treat us like their own set of kids. Um, and everything. I also love like on the academic side that they format the classes to match like our clinical experience really well. So we just learned about lumbar spine, and like later that day in clinic I had a lumbar spine eval that I got to do. And I was able to like do it more confidently because we just reviewed it like in class. So I think they do a good job on it with like making sure everything meshes really well together. Oscar.
Yeah. So I agree with everybody. Yeah, the relationships you build with your cohort, like they say, you sink or swim with everybody. The academic curriculum is great. One thing that I also really enjoy is being able, like, it's about the curriculum and being able to transition what you learn in the class that same day and being able to transition that into your clinical setting and be like listen, I know what I'm doing. Like I'm able to do this, and it makes you feel good and goes to show that the curriculum here and the program here and the professors here are teaching you properly on how to perform the tasks you need to perform as a clinician. So that's probably some of my favorite things that we're able to do here at this program.
So, and then moving on to our next question. This question is for Dr. O, and what exactly is the process of becoming an athletic trainer?
Okay, so all of our students are currently in a program. They're in a program that is what's considered CATIE approved. CATIE is a commission or body of people, educators that have made sure that each program is teaching students the certain level of requirements and a certain amount of things that they need to know in order to become certified athletic trainers. So no matter where you go, and no matter what university or school you want to attend, make sure that program is a CATIE accredited program. Of course, you're not really looking anywhere else but Northern Arizona University. But just to be fair, I'll just let you give you that bit of information. And so if you want to become an athletic trainer, you have to attend a CATIE accredited program. Most of those programs are at minimum a 2-year program. Some of them do have summer requirements in the program. Once you attend the program, then you are eligible to take an examination, which is called the Board Certification Examination. And there's essentially a organization that administers this certification exam to make sure that that athletic trainer has the minimum requirements to be an athletic trainer, and make sure that we are protecting the public from people who are not able to provide great and exceptional care. So once you pass the BOC examination, then you become a certified athletic trainer. Depending on what state that you happen to live in or you want to work in, there will be some other requirements from the state licensure board. It may be just you need to be certified as an athletic trainer. Certainly having some CPR, first aid, AED requirements are also a necessity. But there are in some states you do need to be under the direction of a physician. And there needs in some places you need to have somewhat of a letter chronicling that information. So that depends on the state licensure. But from an academic standpoint, you need to go to a CATIE accredited program, which would be at least a 2-year program, which all of these wonderful students are in. Some of them are just in their first semester, and some of them are getting about senioritis because they're going to be in their last semester, but they're super excited about it. And so once you get through the coursework, we approve you to take the examination, and you take the examination, they will all pass, and they will become future colleagues and athletic trainers.
Exciting. Thank you so much. And then Eric, this next question is for you. And that is, what is the work-life balance look like as an athletic trainer? Is it different for every field that you work in? Yeah.
Okay, well, it definitively has a lot to do with setting in which you're going to work. So, for the ones who are working in or have worked in the collegiate setting, you know, there's no such thing as a day off, literally. It's 7 days a week. Not my choice, which is definitively one of the reasons I never wanted to go collegiately speaking. I will tell you, it is very easy to lose work-life balance if you do not pay attention to it. No one's going to tell you to go home. That's not going to happen. So, there's no such thing as clocking in and out. You're just there when you're there, when you're supposed to be there. So you have to create that niche for yourself in terms of leaving when you can, not being there when you don't have to be. In the high school, it's a little bit easier just because 100% nothing, absolutely unequivocally, nothing happens on Sunday ever, ever, ever. I set a precedence very early in my career that unless we have an event, I do not work on Saturdays as well. So I don't come in for practices on Saturdays. My coaches obviously know how to call 911, and then they communicate with me readily if something happens that way. So I've created that for myself. I would also recommend to not do what I did my first 3 years. Actually, my first 3 years at Coconino, I actually worked for grounds, taking care of the fields during the summer, just for some extra money in the summer. And by the end of that third summer, I'd realized in that last 3-year time frame, I had never left because I was there all summer long as well. So I eliminated that as well, doing something entirely different. In the summer, I totally get away from it as best as I possibly can. The AT job is a little bit easier to do with that. My AD job doesn't allow me to do that as much, but creating that, like I said, leave when you can, set some precedents, set some boundaries early, and stick to those the best you possibly can. And remember, you do not work for coaches. You work with coaches.
Awesome, thank you. And then for the students, again, same process of this. If that is, let me look for the question. I just had it and I lost it. Okay, 1 second. Okay, what should I be doing to help prepare for grad school? And then maybe we can start with Liz.
So I think the best thing to just like prepare yourself for grad school is don't be afraid to get extra shadowing hours or internship hours when you can. Of course, make sure you're first focusing on like getting through your studies and making sure you're getting everything you need to on that side of it. But having that time to be in a setting in somewhere where you can actually see the job on a daily basis, you can get a little bit of hands-on with athletes and with different treatment modalities and kind of just get your feet wet a little bit is so important to not get just shell shocked when you show up on the first day to a grad program. You're going to have an opportunity to do some stuff to just kind of get a jump start on it before it gets started there. And then make sure you're keeping an eye out early for all your prerequisites that you may need. Looking up, ideally everybody would be applying for the NEU program, but for whatever programs you're going to, some do have slightly different requirements. So making sure you're looking up all of those base requirements and ensuring that those are good. I do believe the NAU program is the ones that every CADIA program has. They don't necessarily have anything that's additional, but some of them do have like a medical terminology class that you're supposed to have taken. So making sure you look those up whenever you're applying is really important so you don't get stuck whenever you realize you didn't have one of the requirements. Let's go, Katie.
I definitely agree with Liz. Like, make sure you try to get as much experience or just like go in and see different settings. So like whether that's you're at NAU and you become a first aid tech for a little bit and you get to see what football is like or cross country or volleyball, like go in and see that. If you like have connections through your high school, still like go see them. And like you can even try like the hospitals nearby, like if you're from like the Valley, Banner Health will do like shadowing internships for high schoolers and college students as well. So you can see like the physician side of it. I would definitely say make sure you're mentally prepared and like have a hobby that can help you like relieve the stress as you're going through the program, just because like a lot of things happen really fast. And then especially like on events where you may have like a lot of injuries that are kind of big injuries, you want to make sure you can decompress yourself and not just like hold all that in. Oscar.
Yeah, I would say probably one of the biggest things for sure is having some type of clinical experience, really going in here. So you're not really, so you have building a foundation for yourself getting into the grad program, having your feet set as you come in. And so you're not really, in a sense, like behind everyone else, or like you're in par with where you should be. But yeah, like making sure your prerequisites are there and really paying attention to those prerequisites, because they truly do flow over into grad school. And medical terminology is a big thing, anatomy is a big thing. Make sure you guys are really on top of that as you're progressing into grad school, because it'll for sure help on the long road. And I'll pass that over to Lauren.
Yeah, I agree with everything that you guys are saying. I do think too that like touching on like anatomy and clinical ed like before getting back into the program or starting school is really important, just because like that'll help you when you go into your anatomy courses, and those are so in depth, and that way you already have that base of a foundation of knowledge. I also think too, I think grad school is more professional than undergrad in a way. Like you just hold yourself to more of a professional standard and more like of a mature standard as well. So it's just like really taking the time to find that and what that means for you, and like how that like transitions into your semester of like how you hold yourself, how you study, how you present yourself, how you take your classwork and all that kind of stuff. I will pass it off to Alexa.
Yeah, so I would just add on, because I definitely agree, is kind of try to know and understand the type of student you are before coming into the program. I know for me, I'm a very like, I like structure and I like organization. So like I write out my daily like routines, and I like plan out time for studying and homework. And so I think it was like knowing my strategies for especially the amount of like coursework we do have is really important. Or if there's things, as a student, like, what, I'm not very good with time management, or I'm not very good at like, working out my schedule, or like actually making time to study. Those are really big things to figure out before you come into the program, so you come in prepared, because everything starts day one. The second you get there in the summer, it all begins, classes, clinicals. Like you got to be able to have that balance and be able to figure out your days. So I would say knowing what kind of student you are, and either working on other aspects to be able to make the transition easier would help a lot for grad school. And let's go with Fabian.
All right. Agree with everybody when kind of like having like a like exposure to like athletic training. Like, if you're interested in like a high school setting, there's a lot of high schools out there that are willing to, or a lot of high school athletic trainers that are willing to like, get like bring in somebody to, open up the profession, because, high school athletic training is kind of like a big, it's really needed like in current cities that I know of, at least. And then another thing, kind of like before getting into the program, like make sure that you're like mentally prepared as well. It's some of it's a little like draining, but at the same time, like you also have your other classmates there to like help you like decompress and everything. Find ways to help yourself decompress. And then there's another one I was gonna say. I forgot. But oh no, for study habits. For study habits, like kind of know like what works for you and what doesn't work for you. Sometimes there's study habits that you think didn't work for you, but for a certain class, like maybe that during doing that study habit can help you actually like pass that class. So just kind of be open to either new study habits, or if the study habit that you're not like doing or that you're currently used to isn't working for that class, try something else again. Kind of recycle through those again. Yeah. And then I think that's everybody, right? Yeah.
Okay, awesome. And then for Dr. O, this question is, what is the difference between physical therapy and athletic training?
That's a great question. So a lot of people want to be physical therapists, and a lot of folks want to be athletic trainers. I'd say ideally physical therapists are healthcare professionals that deal with a wide range of, for the most part, physical injuries related to after someone sees a physician and they go and get referred to some type of physical therapy. And it's, the most part of it is rehabilitation based. So physical therapists are specialized in performing mostly strictly rehabilitation for physical injuries, for neurological issues, and they tend to have not necessarily different settings, but they tend to deal with different types of people. So whether it's geriatrics or pediatrics or different types of injuries where something's neurological or something may be just structural in the body, physical therapists usually handle those specific rehabilitation needs. Athletic trainers, for the most part, as I said before, tend to deal with those who are physically active. And so for the most part, we're not dealing with people who may have significantly chronic diseases and can't move and are not moving and are unable to move due to their being in the hospital or some other type of condition. In addition, athletic trainers, and we hear Eric talking about being at practices, we're probably one of the, or if not the only profession which has the opportunity to see athletes and athletics events and experience them going on as it happens. And we get to see people, for lack of a better word, get hurt in the moment. So we get to see people get injured, and we get to take that information about how we saw that injury, how it happened, and process that and incorporate it into this ability to evaluate and get that person better. And then, as Liz spoke about earlier, we tend to see those people sometimes on a closely day-to-day basis and can potentially progress them and make them better a lot faster and a lot sooner because of the amount of contact that we have with them. In addition to the opportunity for us to see those injuries when they happen, we also play a significant part in preventing injuries. So whether you're on a team or you're working with people, we are interested in making sure that people don't get hurt. We're also there when they do get hurt, but we certainly want to prevent them from getting hurt. And certainly physical therapists are not in that area or world where they can prevent people from getting hurt. In addition, we do that same rehabilitation that physical therapists do. There are some populations that we are not really interested in or have the capabilities of working with because of the type of training that we have. So we don't work with maybe, let's say, people who have some significant neurological disease functions, but we happen to deal with other people who have a lot of orthopedic injuries. So our ability to prevent injuries, to be there at the moment and injuries occur, to take care of people really on a more day-to-day basis than physical therapists do, and for us to have kind of this primary ability to take care of those who are physically active really makes athletic training certainly a wide and varied profession. And we have multiple settings in which athletic trainers can work in. We consider the traditional setting, the high school and college, but certainly you can work for Amazon, you can work for an airline, you can work for a dance company, a ballerina company. You can work anywhere where people do physical activities for their job or for sport. So whether it's a recreational athlete, so whether it's just someone just likes to shoot hoops on the weekend, or someone who's on a professional team, and everyone in between.
Great, thank you so much. And then this question is open to everybody, so we'll kind of do the same style, popcorning off to one another. But this student asked a question, why did you choose athletic training over other health careers? And why should I become an athletic trainer over physical therapy or other health occupations? Awesome. So maybe we can go ahead and start with Oscar.
Yeah, I really going like in high school and like going into high school, I didn't really know what I was gonna do out of high school and into college. And luckily, like I said, I did find athletic training and I really like fell in love with it then. But that's really the main reason I picked it is like I said, you could stick into the sports, and the reason I think you would pick athletic training over like physical therapy or any type of like occupational therapy or something like that is you stay with these physically active people, like Dr. O said, we're mostly working with that population of physically active people in a collegiate setting, a high school setting, or like you could be in a professional setting, you could be in unique settings. And I feel like athletic training gives you a broad variety of settings that you can be in. Like you can work with like your local fire department and build up a program there and work with them. You can work with Disney, like Disney on Ice. I knew some athletic trainers that worked with them there. So I think if you want, there's a broad spectrum of clinical settings that you can be at. And I feel like with PT, you're more at one clinical setting, but with a bigger population that you can work with, like pediatrics or geriatrics or severe neurological deficiencies and stuff like that. So I think those are really like the big differences between why I picked athletic training was the clinical settings and the type of people that I would be working with. And I'll pass this off to Alexa.
Yeah, so I think for me, I did intern and work at a PT clinic for a little bit because I wasn't sure if I wanted to do that or AT, but and like that PT setting was very sports specific, so we did get a lot of athletes. But I think for me, I chose AT over PT in the long run because you're not having to do paperwork to convince an insurance company to pay you. I think that was the biggest thing for me. I didn't want to have to every day convince them that like this person needs to keep coming, and it was hard to see that like individuals who really needed PT for such a long period of time were being denied left and right by their insurance companies. An incredibly long process, so that really deterred me from right off the bat. But another thing was that in the AT setting, you create a much better bond with your patient. You see them every day, you grow that trust very quick, and just that like one-on-one connection you make with them is something that you like a very regular patient that comes 2 to 3 times a week, consistently for like a month or longer. And let's go with Liz.
So the reason I initially decided to pursue AT as a health profession instead of PT or a different one, my answer coming right as deciding to do this out of high school was I wanted to get paid to watch a football game in addition to being a healthcare provider. So that was a big draw for me. Was great, cool. I get to be on a sideline. As I got further into like my schooling and like really solidified if this was what I wanted to do, I really loved how we get to work with these patients that have a different drive for the reason they want to get better. In a PT setting, these people are usually getting better for activities of daily living. They're wanting to be able to reach the can off the top shelf without pain. They're wanting to be able to just walk upstairs, which is all awesome. And we definitely want to be able to help those people get to that point. But these patients the patients that I want to work with as an athletic trainer have a reason past that. They don't want to get back to, being able to function normally. They want to get back to a level of performance that they had prior to. So you get to kind of push them a little bit more in their rehab. Once you kind of get them back to that level of just being able to function, now we're looking at getting them back to a level of being able to run just as fast as they could prior to the injury. So that was a really big bonus for me, was being able to play a bigger part in their success and in them being able to return to sport as quickly as possible. Let's go, Lauren.
I think that athletic training is the perfect combination of athletics and healthcare. I think like most people who get into athletic training are like very passionate about athletics and they used to play. And that's kind of what's driven them to athletic training. And then the opportunity to help someone and really get into healthcare is a great combination of the two for athletic training. And I think a really big part of athletic training too that compares to physical therapy is you're seeing an athlete pre-injury, creating that relationship with them. You're there at the injury, post-op, if they need surgery. And then you're following them through that entire process and you're there for them through that whole thing. Whereas PT, you might see them like post-operatively for however long their rehab protocol is, and then you discharge them and you're done. But athletic training, you're really seeing them pre-injury through the entire experience. And I'll pass that off to Katie.
For me, I got to observe a PT clinic for a little bit, and I personally thought it was like a great environment. I learned a lot, but I thought it was too slow in my opinion for me. I enjoy like having the busy, crazy packed schedule of like I don't know who's gonna walk in the door versus having the set schedule. I'm gonna see a knee, I'm gonna see an ankle today. So that was just kind of what drove me to want to go into AT more. Let's go Fabian.
Sorry. For me, it's just kind of that, like how everyone's saying, like, you're building that relationship with those athletes, and you're being with them pretty much, like you see them pretty much like the beginning of their sport, and then you see them at injury, and then you see them, progress back into sport. So I kind of like that, and that's what's kind of like driven me to, be an athletic trainer. And then, um. Yeah, like Katie was kind of saying, like a little. I like the little fast-paced environment that we have, especially being out of high school. Like you're seeing patient after patient. I know there's some people that kind of just want to be like, oh, like I hope I just get one person in today, or like. But for me, it's like like I like seeing like more like kind of like that busier schedule, because like I'm like, okay, like what can I do to help you get better? What can I do to kind of help you get to the level that you want to be at? That's what kind of drove me to want to be in an AT over a PT. I don't know if there's anybody else left. So
I don't think so. Okay, awesome. And then with a few minutes left, oh, I also want to open the floor up to Eric or Dr. O. Did you have anything that you wanted to add to that question?
The only thing I would like to add is simply game day. You work your fanny off all this time trying to get these people back and doing this, that, and the other. I certainly have a great deal of gratitude for physical therapists. They're incredibly needed. And I love the fact that people want to do it. But at the end of the day, they may not even see this person after they've worked their tail off to get them back to doing absolutely anything. And we have the dubious honor of watching kids or patients or whoever you're dealing with return to their activity, and you get to watch them do so. I know one of the students here mentioned I get paid to watch sports and take care of people at the same time. I mean, good Lord, what a great job that is.
Right? Like sign me up. And then this last question is going to be for everybody. So feel free to popcorn to one another again. With 8 minutes left, this will kind of be our closer question. And that is, what is one piece of advice you would give to someone who is just starting off their athletic training journey? And how can they best prepare for success, whether that be in grad school or continuing on after? And we can go ahead and start with Lauren.
Oh gosh. I feel like there's so many things I've learned like in this year and a half that I've been in this program. I think I would just stick to making everything a learning opportunity. Everyone makes mistakes, obviously, like we're all human, but it's using that learning or using that mistake to correct it for the future, and like not getting down on yourself and understanding that you're human, and just like understanding that you're learning and you keep going and you use that experience for the future. But yeah, I'll pass it off to Liz.
I would probably say this career field can be super rewarding, and is something that I look very much forward to being able to get started as a career side once we're done with school. But I think taking a moment to appreciate like every experience that you have along the way is really important, not just going like, okay, I've got to get to what's next, I've got to get to what's next. Like enjoying those parts of it will just one help keep you sane through the whole thing, I think, but also is something important, the stop and smell the roses type mentality. This career, though, I will say, from what I've heard from mentors and seen through different stuff, it requires a level of passion for what you're doing. I don't think this is a career that you can jump into without really wanting to enjoy what you're doing. It is something that is very demanding, both mentally, time-wise, all of the stuff. So getting into this, I do think it requires a level of passion for it and requires somebody that really wants to be there for their athletes, both in the good times and the bad, and being able to create relationships with their athletes and their patients. Let's go, Alexa.
Yeah, so I think the biggest piece of advice I'd have is having something that allows you to decompress. Like for me, I really love to read. And so whenever I get the chance, like I try to set aside like 30 minutes a day to read my own like personal book, and that helps me decompress. I don't have to think about all of the patients I saw that day. I don't have to think about what class was like and all that, and I can kind of get lost in the book for a little while, and that really helps me to like reset and refocus. And so I usually try to do it like when I get home, after classes in clinic, and like right before I have to start doing homework, because then I like can start all that stuff with like a fresh mind. um and I feel more prepared for it. I'm not like drained, and then I'm like, oh man, here comes homework and studying. I'm like, oh, okay, like I'm good, let's go ahead and and get it done. So I think it's having something that allows you to decompress at some point in the day will really put you up for success in this career. Let's go with Katie.
I agree with all of those things everyone's saying. I would like to add networking. Don't be afraid to start networking early on in your career, because like someone knows somebody in like whatever path you want to be in. So like I reached out to University of Wyoming. I reached out to their athletic trainer for rodeo, and I was like, because I just wanted to know more about rodeo. And it turns out we already had like connections at my clinical site at Wyoming. So they were able to be like, hey, like you should make sure to talk to so and so. So don't be afraid to like reach out to people and talk to them about their experience. Oh, let's go, Fabian.
All right. Kind of like my last piece of advice again, kind of going off of what I said earlier, like, one test doesn't defy you. Like how everybody else has been saying also, like, use everything as a teaching moment. You're gonna go into this program kind of like, I know like our professors in Flagstaff last year, they were like, okay, there's a couple of you guys have like previous experience, but what we're gonna do now is kind of pretty much relearn everything. Another thing is also like don't be too hard on yourself. It's gonna be, every like how I said, everything's gonna be a teaching moment. Don't be too hard on yourself. There's some times that you're like, okay, like I should know this already, but it's just take the time to kind of relearn it and like learn. You might learn it in a different way, but now you're learning it, or you were taught it in a different way before. Now you're getting taught it in a different way now. So just be open-minded and to taking in all that new information, or maybe it's stuff that you already know, but just it's not a bad thing to get a refresher once in a while. Let's go, Oscar.
Yeah, what everyone said is perfect. Great advice that everyone should take in when coming into grad school, specifically athletic training. But one thing that I really learned throughout like this first semester for me is take any little win that you can take, it being personally or it being at your clinical site with your athletes. Sometimes during this time it could be always like hectic and it could be just bad back to back, but always take any little wins. If it's your athlete and they actually feel great today coming into you today, that's like the smallest win that you can take. Or hey, I'm gonna do this homework and knock out all this homework before the weekend. Like take any little win and know that you're developing like everyone else is. Like don't think of yourself that you're behind, or you're at pace at what you're supposed to be. Like everyone said, like study, decompress, find your niche is what I like tell people. Find what your niche is and what you're good at, and just go from there.
Awesome. And then Eric or Dr. O, do you have any words of wisdom to leave with our students today?
I think you should just be open-minded. Be open-minded about all the things, here in the program. We're certainly interested in teaching and creating professional and highly educated athletic trainers, but also we understand we're all growing as people. And so whether it's getting you to understand how to manage your time, maybe you never managed your time before, or manage your emotions and manage who you are, or all just growing up and just becoming supreme adults. I think it's certainly an opportunity that we take. So just be open to that. Always continue to learn, no matter how old you are and how many years you've done it. Athletic training is one of those professions that every day is different. And there could be an injury that walks through the door that you've never seen. You've never seen it like that before. You've never seen it swell up or look like that before. And certainly it's an opportunity to keep yourself always educated and learn all the different varieties that exist out there. And that's the fun of it. It's not the same drudgery that people do and they just do everything the same day and they do it day after day. We live different lives. Every day is different. Every athlete is different. Every cohort of students is different. Every team that you work with is different. And so you get to learn and explore all of those differences and grow yourself as a person. So
the only thing that I would add for a potential incoming student to any grad program is just literally know what you are getting yourself into. Educate yourself as much as possible about the program in which you want to be involved. Do, observation hours, internet searches, whatever you got to do, know exactly what you're getting into, especially in healthcare. Athletic training is not one of the things that you just kind of, let's see if I want to do this. That'd be like getting through, medical school and 8 years in, and then all of a sudden you go, I don't want to do this anymore. It doesn't, and it's not very good for you mentally or financially for that matter. So know what you are getting into before you actually enter the field.
Great. Thank you all so much for all of your time today. It's 12:30 and I know you guys have a busy schedule, so I don't want to take any more of your time today, but I appreciate all of you for being here today and such great insight that you offered to prospective future athletic trainers. So thank you all again so much and good luck for the rest of your semester.